trials, diversity is lacking. And then sort of the usefulness of sunscreen and preventing skin cancer has not been done in specific skin of color populations. And so we've done all those studies in fair-skinned patients and know that sunscreen is effective, but we haven't looked at the same data in a skin of color population specifically. So skin of color is a very heterogeneous population. And so I think as sort of in the public health world and as policymakers and influencers, it's difficult to have one guideline for this large group. Like you can see sort of the color spectrum across when we say skin of color. Like you guys pointed out, we're talking about like East Asians, South Asians, different skin types there, Middle Eastern patients, African patients, and even to say African is like feels inadequate to categorize a whole continent together, but you really see a wide variety in the skin tone of the patients, varying degrees of pigmentation, which leads to varying degrees of UV sensitivity. And so really making policies that would sort of encompass that whole range is challenging for sure. So I just wanted to highlight sort of first I'm going to go over how skin cancer looks different in skin of color patients, and then sort of the variety of skin cancers that you see in skin of color patients that you wouldn't typically think about in fair-skinned patients. So when you see skin cancers in skin of color, they're typically more pigmented. So this is a basal cell carcinoma on this patient's face. And in fair skin, and even in all of our dermatology books, the pictures that you see are pink or red papules on the face. But in skin of color patients, typically they present with pigment in them, and they're one of the big mimickers of melanoma. Also, with skin of color patients, you can get cancers in sun-protected areas. So this is melanoma that is growing out in the nail plate, but the actual location of the melanoma is under the skin and under the nail. So not a place that you would think of melanomas popping up. The variety of skin cancers that you see is different as well. So these are all different types of skin cancers that you see here. This is a sarcoma. It's a dermatofibrosarcoma protuberans, which can mimic a keloid. And typically there's delayed diagnosis with these tumors because patients don't realize that that it's not a keloid until it starts growing. Kaposi sarcoma is the middle tumor, and that is a blood vessel tumor, which can look like a pigmented lesion in darker skin. And then on the right, that picture is of cutaneous lymphoma. So lymphoma that is based in the inflammatory cells of the skin, and it can just look like a rash, or it can look like hyperpigmentation or hypopigmentation. And so that's a very challenging one to diagnose and really requires and we have a specialty practice at MD Anderson where I work, where we have multiple dermatologists who only see patients with cutaneous lymphoma, and that is really the largest population of skin of color patients we see in our clinic here. So the incidence of skin cancers, as you guys highlighted, is lower in skin of color patients, but the morbidity and mortality of these skin cancers can be higher. And so then the obvious question is like, okay, so what's the awareness of these different types of skin cancers? Do people know? And there actually, like in the derm literature, there's good survey studies that were done showing that there's decreased awareness among children and parents in skin of color on the different presentations of skin cancer, the skin cancer risks. So a lot of times people with darker skin don't think that we can get sunburned, but we can, and we still get sun damage. And the sort of the awareness over sun protection options and proper use is also decreased. The reasons behind the higher morbidity and mortality, we think, is because of delayed diagnosis due to that decreased awareness, and also the socioeconomic or healthcare access issues, which would be interesting to sort of break those down in the melanoma data as well. So then the spectrum of skin cancer. So I went over those briefly, and I just have some more detailed pictures just because I think all derm talks need good pictures in them. So this was a patient of mine that we saw in clinic, and I hope that none of you are easily grossed out. But this is what we call an acral melanoma. So acrals of the hands, feet, and the tops of the ears are considered acral surfaces. So this was a patient, obviously skin of color, who presented with a new dark line in his fingernail. And we look at those with a magnifying light. We try to see if the pigmentation is even, because in skin of color patients, you can have pigmented lines in the nails that are physiologic. And this did not look like physiologic pigmentation. At his age, he shouldn't be developing new ones. So the standard thing that we do is you want to see where that pigment in the nail is coming from. So we all can see like the little half moon that's in our nail, that white part that's under there. The other half of that half moon is under the skin. And so that is called the matrix. That both halves of the moon together are called the nail matrix. And it's the matrix that's the tissue that actually grows the nail. So if you have a lesion within the matrix, you'll see it come out in the nail. And as the nail grows out, you'll see that pigment or you'll see that growth. And so we knew that if the pigment was growing out in the nail plate, that there was something in the matrix, but you can't tell exactly where it is, if it's in this part of the half moon or if it's in the part that's under the skin. So the normal thing that we do is actually we numb the patient's whole finger. We sort of reflect back the nail plate. So that's what you can see here is we moved the nail plate to the side to look underneath. And we also look under the skin fold. And you can see this was a new melanoma that was under the nail fold within the nail matrix. And it was this little growth here that was causing that pigmented line in the nail. And so really being aware of the different presentations of skin cancer can be really useful. And so we did a little biopsy where we cut this out, and typically, depending on the depth of that, the standard treatment is actually like amputation of the distal digit. So these are so important to diagnose early, and for patients and students to be aware of that these even exist and that this is a way that skin cancer can present. This is a picture of a pigmented basal cell. So like I mentioned earlier, what are tumors that are red or pink in fair skin typically present with pigment in darker skin. You get them with less frequency, but you can still get them. When I was a resident in dermatology, I did a month rotation in India with a dermatologist there, and the diversity in Portland, Oregon is the skin tones that we saw was very different than when I was doing my month in India, and that was when I saw one of the most heavily pigmented basal cells that I was sure was a melanoma on a patient, and it was in a sun-protected area. It was on his lower back that was typically covered by a shirt. The next tumor we had talked about before, we abbreviate them as DFSPs, and they mimic keloids, and they're actually made from the same cell types, but they are seen in both skin of color and in fair skin patients. And this is one of the tumors that we actually want to study and see if our skin of color patients at MD Anderson present at later stages than the fair skinned patients. Because of the prevalence of keloids in darker skin, then people will often overlook this, thinking that it's a normal keloid until it starts to grow.
Let's
or there's something that looks atypical about it. The next tumor is a Kaposi sarcoma, and so these are typically associated with patients with HIV, low CD4 counts. It's a tumor of the blood vessels, and it looks like it's pigmented here, but that pigment is actually from the blood and the superficial blood vessels. And there's also a variant that's associated with Middle Eastern and Mediterranean patients that's not associated with HIV or compromised immune systems. But these patients, when they present with this diffuse presentation, they require chemotherapy for management. And then finally, cutaneous lymphomas, and this is the same picture you saw before. This is a patient of mine where these are the active areas where you can see that's kind of scaly, and you might think it was just like ringworm or eczema, which are or psoriasis, which are common mimickers of it. And then there's also these pigmented areas in the background that are actually active disease as well. If you biopsied from there, you would see the lymphoma. So I think one of the big things I wanted to highlight is that in skin of color patients, we're looking at different skin cancer types, and skin cancer types that we're not even really tracking as part of public health issues. And so I think that's a shift in the mindset for dermatologists and for the cancer prevention community, I think, is to look at a wider variety of cancers than we're typically used to cover the full spectrum of our patients and students. So skin cancer education, I was like embarrassed when I was looking through all of our American Academy of Dermatology materials, and even in my colleagues' like websites on the internet, just Googling around for melanoma guidelines, and you can see that all of the pictures are in fair-skinned patients. And so that's a real area, sort of a knowledge gap, and a need for us is to expand those materials. And one thing in the academic community that we've started working on is making sure that our textbooks and our papers include examples of the tumors or rashes that we're discussing in fair-skinned as well as skin of color patients, so that people get that full spectrum. So there's definitely decreased knowledge in parents and students with skin of color that we talked about, but also our education materials need to be updated. And then really, like, when we're educating as healthcare professionals, to make sure that we are giving due diligence to skin of color patients as well. Even though there might not be the same incidence of the same types of skin cancers, it's still an important educational moment or learning moment to be able to include those patients. And something that I was very proud of is the American Academy of Dermatology. I included the website here, and I'm happy to send you guys the link as well, or the hyperlink as well, that has a section on skin of color and skin cancer prevention in skin of color that's based on peer-reviewed literature and studies, and I included their guidelines later in this presentation. But the AAD has a public-facing webpage, and there's a specific skin of color section regarding melanoma, skin cancer, and as well as other rash types. So just to briefly cover this, because I thought this was interesting when I was looking at sort of the science behind skin cancer and skin of color, and to sort of parse out the risk level that you're dealing with when you have UV-induced skin cancers in fair skin versus skin of color. So this is just a cross-section of, this is the epidermis up here, so that's that very top layer of skin. And then down here, this lighter pink layer is the dermis, or your collagen, and then below that is the subcutaneous layer, or fat. And the blood vessels and hair follicles are seen here. This is what I look at under the microscope when I see these. So this is this layer up here, and then can you see my arrow or no? You can, okay, good. And then this purple, like darker purple pink part that's extending down is the epidermis, and then down here is the dermis or collagen. And so the pigment cells live right at the junction. And so I don't know if you can see the little cells with halos. Those are melanocytes, and those are the cells that make our pigment. And you and I, like fair skin, dark skin people, we have the same number of melanocytes. I just have more active melanocytes, and then patients who have even darker skin have even more active melanocytes. So when you have sun damage, all of us have equal sun damage in the top layers of our epidermis. It's in the deeper layers of the epidermis where the melanocytes live and where skin cancer sort of typically originates, that darker skin patients have more protection. And I thought this was very interesting. So black skin, like dark skin, has an SPF equivalent of about 13, where fair skin has an SPF equivalent of about 3. So it's not like dark skin is not that much more sun protective. And then one of the interesting things is that the rate of repair of that top layer of skin is the same between fair skin and dark skin. So our DNA repair mechanisms are the same. So dark skin and light skin are still getting sun damage, but it's that tendency for that to turn into skin cancer that's decreased in the dark skin because you don't see the damage in the deeper layers of the epidermis. And then another important factor, and I experienced this personally when I was in second grade, I had a pigment disorder that was very similar to what you see in this patient here, where it was inflammation right where my dermis and epidermis meet, where a pigment cells sit, and then it caused all this pigment deposition in my skin. And one of the big things that you have to do is sun protect to help decrease the deposition of that pigment. It makes the pigment less just to be out of the sun. And so one of the things I think that's underrated when we're looking at skin protection is how this affects pigmentary disorders and dyspigmentation of the skin, which is a much bigger deal in skin of color patients than it is in fair skin patients. So post-inflammatory hyperpigmentation, I'm sure you have all seen like kids with acne who end up with the dark spots on their face. That's worse with sun than melasma. A lot of people have experience with that, where you get sort of like the mask of pregnancy or the darker pigmentation on the cheeks and face of women. Lichen planus pigmentosus is what this patient here has, which is the inflammatory disorder. And then patients who have connective tissue diseases like lupus are also very sun sensitive and phototoxic. So when we're talking about sun protection, it's not just for skin cancer, but it's also for all of these other pigmentary disorders and rheumatologic diseases. And then sun exposure also causes some level of photoimmunosuppression, so it can affect your immune system. I know that my time is running up. I'm almost done here in the last couple slides. So what are the risks with sun protection and skin of color? And this is, I feel like these are the two things we see in the popular media quite frequently. So decreased vitamin D, and that is correct. When you have darker skin and are extremely sun protected, your vitamin D can be low, and oftentimes just like multivitamin supplementation is all that you need. And it's really like the sun that you get on your hands walking in and out of the car every day, and when you live in the South or in sunny areas, is enough to get your vitamin D. There's good studies that show, like in New England in the winter, when everyone is like totally covered up, that's when people's vitamin D gets lower. So it is a good thing to check. It's not as big of a deal, I think, as a lot of people think it might be, because you require very little UV exposure to get that vitamin D that you need. And then sunscreen toxicity. So this is really interesting, particularly in kids. The smaller you are, the more body surface area you have compared to your volume. So in any topical treatment we use, we're very aware that kids have a higher absorption compared to adults. And the same thing goes with sunscreen. And there are good studies showing that we get some level of absorption in the chemical sunscreens. So when I say chemical sunscreens, those are the ones that like have oxybenzone in them. They're not the zinc and titanium ones. The zinc and titanium sunscreens are mineral blockers. And the studies that focus on sunscreen toxicity are with the chemical blockers. So personally, I always use the mineral blockers, and that's what I recommend for my patients, because I do think that this literature is real, and there's many studies with good evidence showing that that there is absorption, and you see elimination in the urine of these active ingredients. And with kids, we have to be aware that they have less efficient elimination and that they'll have a higher absorption than adults will. I included here the best practices from the American Academy of Dermatology, specifically for skin of color patients, and this is regarding skin cancer. So these are things that you have heard already and are in the literature for all skin cancer types with some modifications. So seeking shade whenever possible, wearing sun protective clothing. Then the wide-brimmed hats and shoes that cover the entire foot because of the skin cancer risk there as well. Wearing sunglasses for UV absorbing lenses. And then this is where it's like a little controversial about sunscreen types, because typically the inorganic filters, so titanium and zinc, are less cosmetically appealing when you have darker skin because it gives you sort of that grayish cast. I still wear mineral sunscreens, and I still recommend that my skin of color patients wear mineral sunscreens because of the decreased risk of toxicity and because they just work better. And so even though, and there are a lot of companies that are addressing this need now, where you can get sort of tinted sunscreens that match skin of color, and it is a little more effort on the patient's part, a skin of color patient's part, to find ones that work well for them, but the nano particles make it easier as well for that sunscreen to rub in. And a lot of times it's only when you see like the picture flash, where the flash is reflecting off of a patient's face, that you'll see that grayish color. And then, of course, avoiding exposure to indoor tanning beds, taking a vitamin D supplement, and that's good for skin of color patients in particular. And then performing monthly self-skin exams, but tailoring that to the patient's skin type. So helping patients be aware that they need to look on the palms and soles and nails and in areas that are sun protected. So in summary, there's an unmet need in skin of color in terms of research, education materials, and then obviously healthcare access and skin cancer screening. And then students of color regarding the skin cancer prevention, the AAD has good guidelines. And then I think really skin cancer education should not be underplayed or undervalued in students with skin of color. And this is how dermatologists attack the outdoors, and with all the UV protectant clothing. This was me with some of my friends on a canoeing trip in the Boundary Waters in northern Minnesota a couple of years ago. So I take it to heart. What we practice, what we preach. Thank you guys for inviting me. If you have any questions, I'd be happy to answer them.
Thank you so much, Dr. Patel. That was very interesting. And I know we have several med students who are on the call today. Does anyone have questions for Dr. Patel?
I don't have a question, but I wanted to say I actually learned a lot. So thank you very much for that, because there were some things that I hadn't considered, and I'm excited to think more about those and to find ways to educate along those lines.
Yeah. Go ahead, though, you with your hand up. Is that Sam?
Hi, it's Sam. Sorry, I had to switch from my computer to my phone. So Dr. Patel, it's very nice to meet you. My name is Sam Guild. I'm the president of AIM at Melanoma. We actually work quite extensively with your medical oncologist there. So, and I apologize if you've addressed this, but, you know, one of the challenges that we have is trying to reach a particular audience that does need education, that they too can also develop melanoma. And I was wondering if you could share with us some ideas on how we reach that audience.
Can you repeat the first part of your question again, Sam? I'm sorry, I missed it.
No, that's okay. So one of the difficulties we have is trying to reach this particular community because they're not necessarily searching for Google on Google skin cancer or the words melanoma. So how do you suggest that we reach them in order to raise awareness of the disease?
So that is a really interesting question, something we struggle with as well. I think one of the, and I do a lot of, I guess, skin cancer screenings or dermatology outreach in our community in Houston. And I think one of the big things is getting people to see dermatologists and sort of taking away I guess, widening people's view of what we do beyond skin cancer, because I think a lot of what we do that involves skin cancer doesn't look like skin cancer. And so pigmentary disorders, rashes, and so we try to, especially in sort of when I do outreach in skin of color communities, we always call it like we won't say that it's a skin cancer screening. We'll say that if it's at a health fair, we'll say that there's a skin specialist here or a dermatologist here Otherwise people are like, oh, well, I don't get skin cancer, so I don't need to see that person. And so I think it's even like the branding that we use for ourselves in terms of what we do. But that's one thing that I've found to be effective and sort of the grassroots efforts. But I think really the big thing is making people aware of the variety of skin cancers that are there, and really education at a younger age in terms of what kids should be looking out for and what parents should be aware of. Like, I can't believe that my parents, like Indian immigrants, put sunscreen on me as a kid, which is very insightful of them, and I think we were in the minority, because most people don't think that it's a big deal when you have darker skin. And so really, I think that education efforts that you guys do in younger children is so important, and expanding the pictures that we show and the patients that we use in these presentations. And it really is on us as well as like healthcare professionals that we need to expand the material that we've put together. And that was really what I noticed when I was putting this talk together, that we have not been good about that.
Thank you.
Thank you. I think, Bree, you had your hand up next. Go ahead.
Thank you. I just had a question. I know in the issue with education materials being more diversified and actually emphasizing real people more than white people has been a problem across like academia in general. Like the forensic anthropology, they actually have initiatives now where they're working on creating better collections and stuff that are more representative of actual groups of people. In the medical field, and especially with the universities and med schools, is there any sort of initiatives that you've heard of that people can get involved to help with those sort of efforts in a similar way?
So the American Academy of Dermatology is working with Visual DX is a repository of medical pictures that many of us use, particularly in our training. And the American Academy of Dermatology is working with them to sort of, and the Skin of Color Society, to bolster those patient databases. And even in terms of when we publish in books and in journals, I sit on a couple editorial boards, and it's the same thing where there's this push for making sure that we, as the arbiters of what's published, make sure that there is diversity in the populations, like in the study itself, and then in the pictures that are represented. So it is a very clear message across the board. But it'll take us a minute to get there for sure.
Thank you.
And Katie.
I just wanted to circle back to what Dr. Patel said earlier. So my parents are Mexican immigrants, and I feel like I'm also part of the minority of people that, were slathered on sunscreen from an early age. But I'm part of one of the current initiatives, SunSmart, where we go into elementary schools and we do these, the 5 S's of sun safety. And we targeted schools here in North Las Vegas, which are predominantly Latino and Black populations. And I was really surprised that a lot of these students were so surprised, like, why are you talking to us about sunscreen when we don't get cancer? Our parents tell us we don't need sunblock. So I think we have an initiative right now. It's just about targeting certain populations.
That is really great work that you're doing, Katie, and that is so important. That's exactly how you reach these underserved populations.
I'll just add a quick shout out for Katie. She's just about to graduate from UNLV Med and heading off to a dermatology residency. So.
Congratulations. Those are hard to come by.
Thank you.
And Wendy.
Thank you, Dr. Patel, excellent presentation. I have a question regarding supplements. I noticed that you mentioned vitamin D, but do you have any insight around vitamin B3 or maybe another vitamin called HeloCare, if that helps prevent skin cancer? Oh, I think you're on mute.
I swear I'm not touching anything.
Oh, there you are.
Back? Okay.
I can hear you.
I don't. So in terms of if we, so the free radical production and sort of the antioxidants, if people want to take an oral to help with cancer prevention or even with pigmentary disorder prevention, then those are pills that we recommend that there's been some evidence that they can help decrease the damage when you have UV damage, to decrease the effect on the keratinocytes and the incidence of skin cancer that's resulting from it. So I think, and I need to look those up because I'm not familiar with those. I think vitamin D supplementation is sort of separate from the UV damage, but the oral antioxidants is what a lot of people use and recommend, and there is evidence showing that they can be useful in preventing sun damage or preventing that DNA damage from the sun.
Okay, thank you. I just heard about this HelioCare product that if you're going to spend time outdoors, it kind of blocks the sun. It's like an extra protection with the sunscreen, with the UV clothing. Yeah, I think I read that somewhere.
HelioCare is antioxidants.
Okay, okay, great. Thank you.
Yep.
Appreciate it.
You're welcome.
Any other questions for Dr. Patel? Well, thank you so very much. I think we all learned a lot, and we truly appreciate your time.